Hello, everyone. Thank you all for joining us and spending part of your evening learning about the Compass Wellness Plans. Just as a reminder, you are all muted, so we can't hear any comments or questions. If you do have a question, please type it in the Q&A box on the right-hand side of the screen. Any questions that aren't answered tonight will be answered via email tomorrow. With that said, I would like to go ahead and introduce Dr. Kim Cooch, the CEO of Compass. Dr. Cooch is a known author and speaker and has been successfully practicing dentistry for 30 years and still practices 3 days a week in Albany, Oregon. He has some exciting information to share with you tonight on the current state of the dental industry and how Compass can help. So, Kim, I'll turn it over to you.
Hey, thank you so much, Heather, and welcome everybody tonight. We've got a lot of people joining us, and I'm really pleased by that. This is a very timely topic, and I'm excited to share these wellness plans with you. You know, dentistry is changing. The profession has changed a lot in the 35 years I've been practicing. You know, the old model, you know, previous to about 1995, it was pretty easy to find new patients. In fact, you didn't even have to market, and new patients found you. And then, you know, for 20 years it was, you know, required a little more marketing, and now things are changing a lot again. And I think that I think you'll find what we have to share with you tonight very interesting. One of the biggest climate changes for us all, and we've been working on this as a team for 2 years, so I'm pretty excited to be here tonight. It's been a long time in coming. I've been waiting for this day for a long time, but one of the things that we identified a couple of years ago was that the Affordable Care Act is going to have a huge impact on dental benefits, and probably not in a positive fashion. And so if we don't plan ahead and do something about that, you know, obviously it's going to have a huge impact on our ability to practice dentistry. So particularly those of us who are in private practice. You know, when we look at some of the key climate forces going on, the changes that we see, you know, number one is there's been a declining utilization of dental care by all adults in the last 10 years. There continues to be financial pressure for employers because of the Affordable Care Act. I'm going to talk about that just a little bit more. There's increased pressure on you and I to be more efficient with our patients and our time. There's increased integration of healthcare delivery and financing. I mean, I know that you experience this every day in your practice like I do. Most patients are starting to finance their dental care. You know, it doesn't take very much to get into a 2 or 3 or 4 or 5 or even a $10,000 treatment plan these days because of the cost of, you know, implants and partials and, you know, cosmetic dentistry and even, you know, periodontal therapy and root canal. I mean, you just add those things up and they're expensive. And, you know, so that's a burden for a lot of patients, and being able to finance it helps them a lot. The middle class in the U.S. has been squeezed a lot in the last 6 years. You know, their real incomes and spending power have gone down, and I think we're seeing that reflected in our industry as well. And then there's being increased consumerism in dentistry. Some of that's reflected in the type of corporate practices that are growing around the country. I practice in Albany, Oregon. This is a rural town, a population of about 55,000 people. We have 5 different corporate practices now in Albany, and that's happened within the last 5 years. So, you know, that's certainly changed the market for me, and you know, in my own practice, and I know that probably all of you are being impacted at some degree in your practice as well. You know, this is so timely because this came out. I got this issue. This is the December issue of Inside Dentistry, and I got it yesterday morning, and I shared it with my team. And you know what I really want to highlight from this article, and if you guys haven't seen this, take the time to read it, because this is really the topic that we're talking about tonight. You know, PPO-driven practices are becoming the norm in most markets, along with HMOs and a lot of the more competitive markets. Macroeconomics has impacted employers. It's making it, you know, margins are tighter than they've ever been. Expenses are up. It's a greater cost for them for the Affordable Care Act with the insurance, you know, and benefits for their employees. So, you know, insurance companies have been struggling to sell plans to the employers, particularly the premium plans. Patients don't seem to know the difference between a premium plan and a minimal plan. A lot of these plans have low reimbursement. They have stagnant yearly maximums. They have a tremendous amount of paperwork associated with reimbursement, so that leads to underutilization. And of course, that's how they sell it. That's how the insurance companies, you know, base those plans. You know, and I don't know about you, but my my front office people spend half their time now identifying and explaining benefits, and really become benefit counselors. And so, I'm feeling the pinch, and I know that you're feeling the pinch as well. And this article came out this morning, or I got it, yesterday morning. And if we look at it, I think it's really interesting because they had a chart in this article, and they talk about yesterday, the changes in our role and the key trends in dentistry over the last, 45 years. And, we used to be an artist, and, we had an accountant, and we assembled a team of people, and the business model was primarily surgical. And, our technology was basic. I mean, I started with a pegboard system for my accounting and bookkeeping and appointing. There was no communication basically between us and their other healthcare providers, physicians, et cetera. There wasn't a lot of dental insurance. It was just starting, so primarily most of our work was fee-for-service. Our team size was small, and patients needed a reason to leave you. They didn't just need a reason to stay. They needed really a reason to stay. Patients were very loyal. From 1995 to about 2020, their prediction is, now we act more like an acrobat. We're more of an administrator in terms of our business. With our team, we're more like an air traffic controller. Our business model at the moment is restorative. That's going to change. Our technology is advanced for most of us. We get some minimal contact in terms of communication with our other specialists and physicians and what have you in terms of that whole oral systemic health issue. Insurance primarily now in most markets is PPO driven. Our team size is medium, and patients now need a reason to stay. And why they really see this going in the next dentistry going in the next 20 to 30 years is really clinically we're going to be architects. We're going to be designing treatment plans. We're going to be an apprentice attendant. We'll have a team of people who will be overseeing them. I have to tell you, that's the way I had lunch with a longtime friend. She worked for me for years as a dental assistant, and she now works in a corporate office. And she explained yesterday at lunch how all of this works, and it's literally, one person overseeing a bunch of apprentices in an assembly line, basically. The business model is going to be more preventive. The technology is going to be more interactive. You're going to have moderate to high communication with the rest of the healthcare system. Insurance is going to change to outcome-based reimbursement, and we're already starting to see that. Insurance companies that I've been consulting for are looking at, we want to reimburse based on knowing that there's evidence that this treatment is going to provide a predictable outcome that's going to last a long time. And so they're starting to look at just not what's been a traditional procedure, but starting to look at, let's see the evidence and let's see the outcomes, and we're going to base our reimbursement on that. Team size is going to be large. They're predicting large practices, for the economy of scale. You're going to have 2 to 3 or 4 dentists practicing together with a team in a facility. Cost sharing, that's going to be the norm. And patients are going to need many reasons to stay. So that's really, in a nutshell, this topic for tonight, and what we can do to help our patients and help protect our practice about that. So I just kind of went through all of those, and this is the chart. So it kind of gives you an idea of, where we're headed here in the next 20, 25 years of dental practice. And then this came up this morning, the ADA morning huddle. I get an email every morning from the ADA. I don't know if you guys, do or not, but I signed up for it, and so you get kind of a little morning news paper, on your in your email from the ADA. And this morning's was the headline was "Dentists Disappointed by the ACA's Shortcomings." And I looked at this and I thought, oh, how timely. Even the ADA now is pretty aware of what's going on and what's about to impact us all. And one of the challenges again is the Affordable Care Act impacts healthcare, but it doesn't really impact dentistry much at all. You have to have dental insurance now for children up to the age of 18 is what I read this morning in their plan. I thought it had been 21, but it's through the age of 18. And beyond that, and actually it was one of the 10 critical components of good health care until you're 18, and then as an adult, I guess you don't need dental care anymore according to the ACA because it's not included. So it really puts us in a pinch. These patients are going to end up without dental insurance, because of the Affordable Care Act, and then I'm going to show you the statistics about what happens when patients lose their dental insurance. If we go back and look at the last, 14 years, the overall utilization of dental care by adults has gone down. It peaked in about 2002, and 2002 was actually also coincidentally the peak of people, a percentage of people in the United States that had private dental insurance. So we know that, you know, having dental insurance affects the utilization rate of dentistry, but it's on a decline. For children, it's been fairly steady. You know, it rose for a little bit. It's been kind of steady, and that's still the trend that we see today. The annual growth rate in terms of real per capita expenditure in dentistry, total health care is on the left. We actually outpaced for a lot of years. In fact, you can go back probably to 1970, and we outpaced medicine, you know, by a small percentage like every year. And we saw our, you know, dental incomes rise, and we, you know, and particularly after about 1990 when you saw the restructuring the organization of medicine, you know, physicians got this, you know, the cram down and the squeeze, and they're working for corporations and insurance companies now, and they've been on, you know, their real incomes have been on a serious decline for 20-some years. But then in the, you know, after 2002 through 2008, real expenditures in dentistry started to decline, and actually in the last 4 years, we're in negative growth. We're actually getting smaller year by year in terms of real actual expenditures in dentistry. So to be able to have a growing, thriving practice in an economy or market where the utilization of our services is in a decline, that's a challenge for all of us. And so we have to find a new way to I think, approach that. This was a survey that was published in JADA back in February, and they looked at what are the utilization rates of adults and what kind of things affect that. And what they found was individual factors such as being a woman, being married, and non-poor, and having an education level and private dental insurance were associated with seeking regular dental care. And older adults who lived in a community that had a higher dentist to population ratio were more likely to use dental services than people that were in a low ratio area. So when we know what the utilization factors are, and we know that primarily more women than men seek ongoing regular dental care. The majority of our patients are women. If you go look at that statistically, I know that you'll know that. You'll find that in your practice as well. One of the things that shifted on this, and one of the concerns, and one of the goals of the Affordable Care Act was to try to help unburden the system from patients who didn't have dental insurance going to seek help in the emergency room. And what they found was that when we looked at emergency room dental visits, basically a little over 70% of the patients that came in to the emergency room with a dental emergency, 70% of them did not have dental insurance or they were on Medicaid, which has very low reimbursement, almost non-existent, particularly for adults. It has some reimbursement for children. And then another survey that was just published looked at the costs, and actually, so that X-ray and exam and prescription in your office, I don't know what you charge for that, but that cost the patient, it cost the system $760 in an emergency room, and that represents, dental emergencies represent only about 1% of total emergency room visits, but it comes at a cost of $760 a crack. So that's an issue and a challenge. If we look at the statistics on dental insurance in the last 10 years or so, they peaked like I said earlier, in 2002, where about 60% of Americans had dental insurance, and that's when we saw the highest utilization or number of patients seeing dentists regularly in the United States. One of the things that we know that this is actually from the insurance industry, this data, 81% of the patients who have dental insurance see a dentist twice a year. If you don't have dental insurance, only 34% of the patients see a dentist twice a year. So right now we're going to look at a pool of patients that have dental insurance coming in to see us twice a year being shifted into a pool they're going to lose their insurance, and less than half of them, a third of them, are going to be coming in to see you on a regular basis. So you're going to see patients more and more come in just in emergency or when they're in pain or have a problem. And when by survey, when asked why they didn't go to the dentist, the number one answer, 44% of the people said lack of insurance. Number two, by the way, was it was too expensive. So it's like, they tie that whole thought of having insurance and the cost of dentistry together as well. So if you start looking at those demographics and what I see coming and happening to our marketplace currently, and as the Affordable Care Act continues to be implemented. And this trend, I think, whether it's repealed or not, I think the trend that we see right at the moment in terms of employers becoming more efficient, more cost conscious, particularly with their benefits for patients, I think you're going to see, regardless, we're going to see a decrease in private, or certainly the premium dental insurance plans going forward. So if you don't have an option for your patients, you're not going to be seeing as many patients, and it's going to be harder for you to compete and attract new patients as well. So, we talked about, my fear is seeing these patients shift, from the 81% pool into that 34% pool if they lose their insurance. So I really need to have an alternative, cost-effective alternative available for them. And this is a very interesting survey as well. When they asked patients who had dental insurance, how many of them, that had dental plans, if your employer ended your dental insurance, would you buy it for yourself? And basically the same percentage of people that have dental insurance said they would buy it for themselves, but it was very interesting when they asked the question, what kind of insurance would you be interested in? I mean, the large majority of them were interested in a lower price preventive care only. They wanted to make sure that their preventive care was taken care of. Like, that was the most important part, and that's good news. I mean, I think that we've made a difference in our market over the last 45 years, preaching prevention to our patients. They understand that, and so but that's their number one concern, is to make sure that they get in for their checkups and cleanings twice a year. Beyond that, they were willing to, to reduce and make sacrifices. One of the other things that we know, another data point that we know, is 84% of the people who are signing up for the on the state exchanges for the Affordable Care Act are opting out of dental insurance. So they're choosing not to have, what's in the plan. So I think from all of those data points, then I think that's a pretty clear picture of what you and I have to deal with going forward. Now, overlay that with where we're at in the world globally with just dental caries, not even periodontal disease, just dental caries. Of all of the 291 major diseases that are tracked, known to man, and that we keep track of, dental caries is number one. And literally, we are number one in every demographic in every country on the planet. I mean, it's literally, we're the number one disease on the planet. And so, and it's going up, not down. Now, we did just see a slight reversal on our 0 to 5-year-old children in the United States for the first time in over 20 years here from the CDC most recently. But the reality is we've got a challenge, and that's a whole other topic, and I know you and I have spent a lot of time talking about that, and we'll spend more time talking about the cause behind that. But the reality is we're going to have fewer people having access or insurance, which they perceive as providing them access, and we've got an expanding disease and epidemic really globally, not even just in the United States. And then I want to share this study with you. I think any of you that have spent time with me on these webinars as we've gone through all the scientific data. This is the Dunedin cohort, and this was a study that's been followed in Dunedin on the South Island of Australia. They took all the children born in 1972 and 73 in this small town where people tend to grow up, stay, and die in that town. They don't tend to migrate away. They started in 1972 and 73 with 1,037 people, and they still have almost 900 of those still participating in the study 38 years later. And so they followed them and looked at they looked at their entire overall health. It's a major study of a population. But one of the things they're studying is their decay rate. And the interesting thing, in New Zealand, you're provided with dental care through the government-sponsored program in the schools from the time you start school until you're age 18, and then after that you're on your own. So they get regular checkups once or twice a year in the school system and restorative care. What's interesting is that these people in this cohort have all been in traditional dentistry for the last 38 years, and what they found is that the kids that were high risk for dental caries had high dental caries rates when they were children. At age 38, at midlife, have virtually all the dentistry they've had done has not affected their decay rate. And the same thing for people that were moderate risk, and the same thing for people that were low risk. So in a general sense, what we do traditionally in dentistry in terms of drill and fill dentistry and cleanings and what have you hasn't affected the decay rate on this population at all. So what we're doing isn't working. We've got a disease that's growing, and we've got insurance plans that are the whole market that's shifting away from that. So that's a very acute set of, I think, factors coming together, kind of the perfect storm coming here at one time. And so, we need to come up with a plan to do this. So the question is, why would you do this? Why would you look at providing a wellness plan like Heather's going to present here in a minute into your practice? And I would tell you that there's a number of reasons to do that. Number one, it puts you and your patients back in control. I've been doing this for 6 months now, and I have to tell you, I have a completely different conversation with these patients because there is no insurance maximum with these plans. There's no maximum, so that doesn't ever even come into play. So they're more, I think, open to looking at an entire treatment plan than just looking at what does my insurance cover and how much maximum do I have for this year. And I know that you guys hear this every day. I hear this every day in my practice now as well. And I understand it, but this kind of changed that entire field. Maximum, that doesn't even come up. I really look at this as a patient retention tool, and really providing a membership plan like this to be able to retain those patients in your practice, keep them in that 81% pool within your practice. But I have to tell you, this is a huge opportunity to attract new patients to your practice as well. You got to look at it. 50% of the patients now, close to in the United States, don't have dental insurance, and that's the barrier that they see that's keeping them from coming to see you. And so here's a lower cost alternative to get their preventive care done, and it gets them into your practice and gives you an opportunity to provide, excellent care for them. So with that, I just want to thank you all for joining us tonight. And Heather, I'm turning this over to you to explain this to everybody.
Great, thank you, Kim, and what great information regarding what's currently happening with our dental insurance today. My plan is to show all of you a solution that we have, which is called Compass. Compass is a membership program directly between you and your patient, and our goal with Compass, like Kim said, is to really put the patients and the practice back in control. First and foremost, it's important to emphasize that Compass is not insurance. So take a moment to think about what the conversation would be like when a patient comes to you and does not have dental insurance. What are their options? With Compass, you can offer them a dental wellness and loyalty program. So for a small monthly fee, patients will receive all of their necessary preventative services along with a loyalty discount on restorative or cosmetic procedures. A simple comparison to how Compass works is a gym membership. By paying one monthly fee, the average gym membership allows you to have access to the gym and use their equipment, as well as sometimes a discount on things such as supplements, tanning, personal training, and usually there's something free, such as your first month or a personal training session. So Compass is a similar concept. Your patient is going to be a member of your practice. With a monthly payment, patients are going to receive basic preventative services such as dental cleanings, exams, x-rays, emergency exams if needed. Included with this is the added benefit of a 15% savings on all other dental services such as whitening or cosmetic work, as well as a smile consultation. So within the Compass program, there are 3 different wellness plans for you to offer. You have the option of choosing whether or not to offer just one plan or all 3 of them. I'll take a moment and just go over really what makes each plan unique. The wellness plan, which is in the middle, it's our most popular and standard plan. Patients who choose this plan will receive 2 cleanings per year, 1 to 2 exams, along with an emergency exam. They're required x-rays as well. Patients will also have a 15% savings on other dental services and the option of a smile consultation. Now you're probably wondering, what is a smile consultation? The smile consultation is a really great opportunity for you to have a conversation with your patients about what they want and what they envision long term when it comes to their smile. There's also the Kids Wellness Plan, and this is similar. However, it also includes a fluoride treatment. And then the Perio Wellness Plan offers 3 to 4 cleanings versus the 2. We also offer a very unique ability to send prescription dental products to your patients quarterly. And so this is an optional add-on for the dentist and the patient. Now, let's review some of the basics on how offering Compass plans work. The best part is that you are really able to make some of the basic decisions on how Compass will work in your practice. There are 5 different price levels that you can choose from. This will determine the patient's monthly fee as well as your compensation. This way, you can align the price with the price level with your current fees. You're also able to set any exclusions you would like for the 15% savings, such as what cosmetic and restorative procedures it applies to. And having the option to choose exclusions and what plans to offer, there's a point where it really puts your practice in control. There is no third-party influence. For example, you're not having to send in any pre-authorizations or any codes. And this is a really huge benefit of Compass not being dental insurance. As far as what Compass does, we will do the work for you. We take care of the basic behind-the-scenes process to take the extra work off of your shoulders. Your patient's payments will be set up automatically and processed by us. We will send the payments to the practice on the 15th of each month for the patients you have signed up. We also provide an experienced marketing team to help support your membership plan growth, which I will discuss more in a moment. Our goal with Compass is to assist you in securing your patient base. Your patients are now members of the practice. Compass allows you to really build a long-term relationship with those members. Case acceptance will increase, and patients will be much more likely to move forward with the treatment plans when they have the added benefit of a 15% savings. By giving your patients a month-to-month option, it's really more affordable for them, which will increase the fee-for-service patients. And as Kim mentioned, there is a growing amount of patients without dental insurance, and this will be a huge marketing point for new patients as well. As far as getting started goes, it's very easy. After visiting our website and reviewing the different plans and pricing, you can sign up to be a provider. From there, a custom web page is created for your practice showing your information and the plans and pricing you choose. After that, a code is generated for you to add a button on your site linking directly to this page. Once you have that installed, you're ready to begin signing up your patients. You really can become a provider in a matter of minutes. So I'll go ahead and show you what this process looks like. I'll walk you through it. Once you arrive at compassdentist.com, you will see Become a Provider in the top right-hand corner. And after you click that, a pop-up will appear. And it's just a simple form asking for some basic information, such as your name, phone number, and email. The next page is where you are able to review our plans and price levels and decide which one will be the best fit in your practice. Here there are 5 different price levels to choose from. There's also a sliding percentage scale below that. And when it comes to pricing and compensation, we really want this to be a partnership with you. So the more patients that you sign up with Compass, the lower your fees will be. The percentage scale starts at 12.5% and goes down as low as 7.5%. While you're on this page, it's also a really great time to review other parts of our website, such as the FAQ page and the resources page. And then from there, once you've chosen your plans and price levels and are ready to move forward, there's just one last section where you create a profile for your practice. During this process, there is a one-time activation fee of $795. Once this is completed, you're now a provider, and this will lead you straight to your account. One of the first things you'll see in your new account is a reminder to add that button to your website. This will really be the easiest way for your patients to sign up outside of the office. Let me show you an example of an office who has added the button. So this is Dr. Lawrence in California, and her office has added the Compass button to their sidebar, and this will really stand out to patients who visit their website. They can sign up directly with her practice simply by clicking on it. At Compass, we see this program, like I said, as a partnership, and it's our job to make sure that this program is successful in your practice. We have a number of marketing tools and options we provide, as well as a tremendous amount of marketing support. We are only successful if we make sure you're successful. At the moment, Compass is currently testing some co-op marketing opportunities to help bring in new patients, which we hope to offer to practices in the near future. So now that I have reviewed the basics with how the program works and how to sign up, let's go over why you would do something like this in your practice. The primary reason patients avoid the dentist is a lack of insurance. By offering an in-house membership plan as an alternative to insurance directly through the practice, dental professionals are addressing the primary barrier to increase new patient flow and practice growth. It sticks. By making small monthly payments for the membership plan, their dental membership quickly becomes a habitual part of their monthly expenses rather than an unexpected or unbudgeted variable cost. This really allows the dental practice to build a patient base with a membership mentality that will increase patient retention and secure patients to their practice for life. It's sold anywhere, anytime. Dental practices, they often lose potential new patients simply due to availability. By offering the monthly membership plan on a practice website, it can be purchased by new or existing patients at any time. So that's one reason why it's really important to add that button. Rather than giving a potential new patient a business card or telling them to call the practice during business hours, patients can go straight to the practice website and sign up immediately. The entire dental team can, in effect, become full-time sales ambassadors for the dental practice. This is also pretty important, very important actually, when it comes to ROI on marketing endeavors. Whether using social media, mailers, or other media forms, new uninsured patients may want to join their practice on their own time. Instead of a call to action of filling out a website contact form or having them call you during business hours, these patients can purchase it immediately. It puts the responsibility of the appointment on the patient. A membership plan also creates a very smart psychological change in the business dynamics between the dental practice and patients. Hygiene appointments are very important in a practice. Instead of chasing existing patients with or without standard dental insurance with mailers or phone calls, sometimes texts and emails to make and maintain their hygiene appointments, membership plans really puts the responsibility of maintaining those appointments on the patient rather than the practice. While it's recommended to notify patients of their lapse in dental care, a patient's membership dues are being paid automatically to the practice. And if the patient chooses not to make and maintain their appointments, the financial consequences are already built into the membership plan. An average of 18% of patients who have coverage for preventative care do not see the dentist twice a year. Instead of an insurance company reaping the financial benefits, it goes to the practice, and that's where it belongs. And lastly, independence and control. It's a very important one. One of the biggest issues dental practices that are dependent on insurance patients face is the lack of control over fees and payments from dental insurance companies. With our wellness plan, the practice sets the prices, sets the fees, and the exclusions for any discounted services, putting them in control of their own revenues. As the number of insured patients continues to decrease and costs continue to rise, dental insurance companies are really putting the pressure on practice providers in order to maintain their revenues. By building an independent membership patient base, practices begin to build a more secure future. So those are some great standout reasons why you should do Compass. That is the information I have for you today about the Compass Wellness Plans. And so at this point, some of you, it might be a no-brainer. Some of you may feel ready to become a provider, and others may want to spend some more time looking over our website and our FAQ page. But either way, when you're ready, I would love for you to give me a call so I can answer any questions and tell you about a great discount code that we have off the activation fee during the month of December. I will be here the rest of the week from 8 a.m. to 4 p.m. Pacific time, and the number is on the screen as well. It's 855-272-9581. So I look forward to hearing from you and helping you become successful with Compass. And Kim, did you have anything to add?
Heather, I was just watching, this whole presentation with you, and just sitting here reflecting in my own practice, what's happened with the Compass, and it's been amazing to me. This is such a powerful tool for retention of I've had so many patients in the last year that have lost their dental insurance and come in a panic, like, what am I going to do? What am I going to do? And I have a solution for them. And they've signed up, and it's really made me feel good to have an opportunity to know that I can help this person. I'm not going to lose them. On the other hand, what's happening more significantly right at the moment in my practice is I'm getting a lot of new patients coming in because of Compass and wanting to sign up on that plan, seeing as an option for them or an opportunity for them to be able to seek regular dental care. I know that if I were a practitioner listening tonight, I'd have two concerns. One would be, gee, I'm giving a discount, and I would share this thought with you that the discount in terms of, the additional dental work that the patient receives, those are from your normal fee schedules, and they tend to be less of a discount than a number of the insurance plan fee schedules that you're probably already working with are. So, I looked at it and thought, well, gee, it's not as bad. I'm using my full fee schedule with these patients and giving them that discount. And the other thing, Heather, you brought up for a second there was, and I have this conversation with my patients, it's like, and particularly right at this time of year, because it's like, well, let's use the rest of your benefits for the year if you need anything done, because, at the end of the year, the insurance company doesn't take the balance and write you a check and send it to you. They don't send it to me. They keep it and put it in their pocket, and those were benefits and dental care that you could have had that you'd already paid for, and the only person, making out on this deal is the insurance company. And so in this situation, if, changing that nature of that relationship, if these patients don't show up for their cleaning or they don't schedule or whatever, and we know that statistically about 19% of people who have dental insurance don't utilize it even after they purchased it, I still get paid. I get paid the membership fee whether they show up or not. So those are a couple of data points that I think that are significant if you look at this from a business model. But it's a huge opportunity to help provide access to the patients who have either lost their insurance because of, or going to lose it because of the ACA, or don't or haven't ever had insurance and don't see that as a barrier for them to be able to come see you. So I think both of those aspects are huge, and I can't say enough for it. I mean, I'm absolutely impressed with what's happening in my practice because of that. So I just wanted to share those thoughts with you. And with that, Heather, we can call it a night.
Great. Thank you so much, Kim, and thank you, everyone, for joining us tonight. As a reminder, for any of you who asked questions that we didn't answer,